Hello everyone, warm greetings from India and Namaste. My name is Ankit Keshri. I am a doctoral student at the Tata Institute of Social Sciences, Mumbai. In this brief presentation, I shall quickly explain how the study Professional Social Work Response to COVID-19 affected families in India, facilitating services and building awareness during the second wave came into being. I will also briefly mention the purpose of the study, explain you the sample details, and I will also share some highlights of the findings. Now we all know that COVID-19 has posed unprecedented challenges to the health and economic systems globally, and it impacted everyone. In many parts of the world, the professional social workers engaged with pandemic affected families and communities, and India was not an exception. So, this study was conceived to capture the support provided by the professional social workers in India during the second wave of the pandemic. Now, let us discuss how we conducted this study. Though it is a pan India study, we collected primary data using a purposive sampling method. For that, we designed a short online Google survey and pre-tested it for ethical and content validity aspects. Through the survey, we covered three categories. First, the department and schools of social work. Second, civil society organization or units of government and quasi-government organization that is headed by professional social workers. And third, individual professional social workers who did notable service during the second wave. The purpose of selecting three categories was to triangulate the data collected so that a comprehensive picture of interventions taken up by the social workers can be captured. We collected the data between 12 July 2021 to 24 September 2021, a month after the peak of the second wave got over. The final study sample came to be 68 department and schools of social work, 130 CSOs and units headed by professional social workers, and 142 individual professional social workers. Now let us look at the slide in order to explain more effectively the roles played by the social work profession during the pandemic. For that, the study used the framework suggested by Global Social Service Workforce Alliance. Therefore, in our study, we could identify 10 major roles played by professional social workers in India that they performed during the pandemic. Although these roles are not watertight compartments, they can be explained better by looking at them through the GSSWA framework, that is, by using the promotive, preventive, and responsive categories. Now, in this slide, I will explain what we found in this study. To begin with, we found four key promotive roles played by the social workers, that are building awareness about COVID-19's appropriate behavior. They were also involved in networking with the government, NGOs, and CSR programs. Next, they provided information regarding the availability of COVID-19 tests, vaccines, help desks, quarantine centers, oxygen supplies, and entitlement documents. Finally, they recruited, trained, and supplied volunteers and social workers to the COVID-19 war rooms. We also found that social workers played four key roles in response to the second wave of the pandemic. They extended psychosocial counseling support and distributed relief and hygiene materials to the affected families. They were also in the forefront in terms of managing help desks, quarantine centers, and COVID 19 test camps. Further, they effectively channelized the local philanthropy and community resources to meet the needs of the affected families and communities. Lastly, the two key preventive roles they played were reaching out to the unreachable and invisible population groups, such as the elderly, tribals, disabled people, prisoners, and young caregivers, and also starting new initiatives and helping government and CSOs to assess the ground level situation for the effective delivery of relief activities. Now, in this slide, I will quickly explain what are the challenges social workers experienced while working with the COVID-19 affected communities and families. Some of the challenges they experienced were lack of funding, restrictions on mobility, and fear of infection. However, as it can be seen, social workers made their presence felt in the field in spite of all those challenges. Now, in this slide, by a way of conclusion, I would like to highlight four themes from the study as having implications for education and practice. Firstly, social workers in India have adopted community based interventions to help affected families during the pandemic. Thus, it is time for us, the professional social workers, to reclaim the community centered approach in social work practice. Secondly, the already existing networks and alliances of social workers were found to be effective tools during the COVID-19 relief work. Therefore, we shall nurture this unique ability in our students during our teaching and training. Thirdly, it has been found that collectivist societies with a strong extended family and community networks coped better with the pandemic and its impacts. This finding in fact validates social workers' emphasis on strengthening community and family as support systems. Fourthly, social workers' ability to effectively channelize the emergent local benevolent action and other resources towards helping the affected families were also evident. I would like to mention here that professional social workers are especially suitable for these kinds of roles. Finally, in this slide, we made an attempt to capture the key findings that emerged from our study Professional Social Work Response to COVID-19 Affected Families in India. You can have a look at it here. In this last slide, I have shared a link to access the full report that is published by National Association of Professional Social Workers in India. Thank you for listening to the presentation.